Jen, do you want to, hold on one second, my printer's down, so I've got a double duty here. I'm looking at our agenda. Is it Dr. Havens that's with us?
Yes, with us tonight. I moved to panelists. So, Dr. Havens, if you should be able to unmute yourself.
So from NYU Langone Health, here to talk about mental health impact on our kids during the pandemic is Dr. Jennifer Havens and Erin Relaford. So please, thank you for joining us, and please go ahead and begin anytime you like.
Can you see us?
Yes.
Okay.
Yes.
So I'm just the MC here. Good afternoon, good evening, everyone, and Community Board 1. We're delighted to be here. I'm Jennifer Havens. I'm the chair of the Department of Child and Adolescent Psychiatry at NYU Langone Health. And I also have a role with New York City Health and Hospitals doing strategic planning for child and adolescent for that system. And as Trish, are you the host?
I am the chair of this committee, and then we have Jen Maldonado from Community Board 1, who's our moderator. Jeff Myhawk is our co-chair.
And who can we meet everybody just so we know who we're talking to, since there's not a lot of people?
Of course, let's go ahead and introduce ourselves. So Jeff and I have gone. The rest of the committee can introduce themselves as well.
Hi. My name is Sara Bataroni, and I have 2 children in the New York public school system. One is in high school and the other in middle school.
God bless you.
Sarah, is that a virtual background?
Oh no, I've been coming into the office now. Everybody's been called back, man. It's like the good days are over.
I had a student who had a virtual background that had an active loop of someone coming in behind him and putting something out. And I finally had to be like, can you please turn that off? It was so distracting.
No.
It was a video loop of a person walking and putting something down and walking away just over and over.
Jeff, I wish I was that talented. Seriously.
Who else do we have from the board?
Good evening. I'm Daron Charkoudian. Been on the Youth and Education Committee for a couple of years, and I have a daughter who's finishing up kindergarten at the Peck School.
Excellent.
Thank you for joining us tonight.
Oh, our pleasure. Who?
Hi, Andrew Zelter. Been a member of the committee for several years as well, and have 4 children, 2 of whom are in college and 2 of whom are in high school.
And you're a teacher?
No, I am not a teacher. No.
Oh.
Hi, I'm Sarah Cassell, and I've been a member of the Youth and Education Committee the last 2 years. I have a son who was born and raised in Battery Park City and now is in college.
Great. Is that everybody?
Schools.
No, we have more. Wendy?
I'm Wendy Chapman. I have actually 2 college-age children now and 1 high schooler. So.
Great.
Rosa?
Hi, my name is Rosa Chang. I am a community board member, but not a member of the Youth and Ed Committee, although I sit in on a lot of these ones. And I have a 2nd grader at PS 150.
Great. So again, I'm Jennifer Havens. Aaron, you want to introduce yourself?
Sure. I'm Aaron Relaford. I work with Dr. Havens here on the Department of Child Psychiatry at NYU. I'm the Child Psychiatry Fellowship Training Director, and I also have a role where I'm the Director of Child and Adolescent Psychiatry at NYU Brooklyn. It's so good to be here. This is the 2nd time I've gotten to present to Manhattan Community Board, and I, like many of you, have 2 young children. My daughter is 7, my son is 4, and so I'm really happy to come and talk to you about how things have been during COVID.
So how do we share our screen? We have slides, of course. We wouldn't be academic nerds if we didn't have slides. So we want to, share?
Yeah.
Dr. Havens, I shared past presenter roles over to you, so you should have screen sharing controls. If you look over at the top of your screen, there should be a tab labeled as share, and then if you hover your mouse over it, you'll see different options like share my file, share application. And if not, I'd be more than happy to share my screen and present the slides.
Okay, maybe you should, because I can't find the share button, and I have a technical person here with me, Aaron.
No problem.
So, just to give you an overview, we've been quite affected in this entire country, but certainly in New York City by the COVID epidemic, and Aaron's going to present in more detail. We're facing some really significant challenges right now in terms of the capacity of the kids' mental health system to meet the demand. And I'm going to let Aaron go through some of the general stuff. Obviously, this is an epidemic or a pandemic that affects everybody across all classes, demographics, and races, has particular impact on more vulnerable kids. But it's also a pandemic that affects adults and kids together, which is, I think, one of the reasons why it's so incredibly stressful. You know, we know what we know about sort of traumatic and disaster psychiatry and mental health is that the predictor of how well a kid does is how well their family can support them. And that's one of my theories about why this is so hard for the kids, and we're seeing such increased rates of problems because everybody is maximally stressed, and it's obviously not good for kids not to go to school for a year and a half, nor is it good for their parents. I won't tell the story about the day I called Aaron and he was done with his 2 young kids, right? So I'm gonna, Aaron, you want to, are you okay there?
No, that's perfectly fine. I think that I think that what you just said just now is perfectly apt. I mean, starting off the story with the parents and how challenging it has been for them. You know, parents have had to juggle lots of things. Early in the pandemic, in the middle of the pandemic, before the kids went back to school, the parents were juggling work. They were juggling, you all were juggling work plus childcare, plus being teachers as well to your kids. There was a lot of financial stress. People were losing jobs. It was actually disproportionately, women were disproportionately impacted during this time, moms. And it was just sort of stressful all around. And it was a lot of uncertainty. And parents had to manage their own mental health as well as think about how this is impacting their kids. And kids, of course, you know, opening that story to what we're going to talk about today, you know, the kids really were struggling out of school, isolated from their peers. They were missing a lot of milestones, really important religious transitions, graduations, a lot of things that just kind of get overlooked that are really important that kids just didn't get to celebrate, which are important factors in the lives, in our lives over time. And I think another part of kids not being in school was that they were not monitored by teachers. They weren't monitored by administrators. And I think a lot of kids being at home in stressful environments were subject to stressful homes and possibly abuse. And I think those things weren't being reported in the way that they have been before. And I think that's also been challenges for kids. So, I mean, I'll start the story off from sort of the beginning. You can move to the next slide. I think she has control, Jen. Okay. Early on in the pandemic, I mean, we didn't know much. Things were shutting down. We initially had thought that kids were not impacted as much medically, and then there was this concern about this toxic shock syndrome. Now we're learning a bit that kids are sort of do have some post-COVID things. Early on, we didn't have much racial data on how disproportionately kids from different backgrounds were affected. Certainly, we started to understand that there was more anxiety and depression, but the data wasn't as robust as we have now, which we'll talk a little bit about later. And then certainly there was traumatic stress. You know, people being in the home, being afraid of COVID, afraid to go outside, being exposed to trauma in the home, as I mentioned. And, there was the question of that developmental impact. Like, how is learning on the screen? How is being away from other kids? How is being out of school going to impact our kids? And so there was a lot of questions early on, not a lot of answers. You can go to the next slide. There was a great study that was done in I believe November.
Summer of last summer, yeah.
Yeah, summer last year. And what it essentially talked about was the financial, the economic impact on kids, as well as some other factors. And what we learned from this study was that certainly there were a lot of children that lost caregivers. So in New York State, there were about 4,200 kids who lost a parent or a caregiver. And one of the important factors that came out was that there were racial disparities there, right? So there were one in about 500, 600 African American or Hispanic kids that lost a caregiver, compared to 1 in 1,500 Asian Americans, as well as 1 in 1,500 Caucasian Americans. And so that disparity was something that was really interesting. And then if you go to the next slide, it sort of, oh, you're going to say something, Jim?
Yeah, this you can get this study. It was done by the United Hospital Fund. And if you go on their website, it's called the COVID Ripple Effect. And they were replicating some work they'd done looking at the impact of the opioid epidemic on kids specifically. They did this just for New York State. So this is only the first 6 months of the pandemic. It's not the entire pandemic, but it was an immediate signal to us, which we were figuring out pretty quickly, that there was a very disproportionate impact in the populations of folks, particularly low wage earners, people who had to go to work, et cetera. So it was quite striking. But if you want to see this study yourself, it's available publicly on the United Hospital Fund website.
Yep. And so as I was mentioning, it was primarily looking at what was happening early in the pandemic, from March until July, and the results came out in the fall. You can go to the next slide. So one thing that was interesting, of those 4,200 kids that were in New York State in total, 57% of those kids that lost a caregiver actually lived in the Bronx, Brooklyn, or Queens, in New York City. So in all of New York State, most of those kids were in New York City, in these areas that have high concentration of individuals from marginalized backgrounds. Go to the next slide. And what the study showed, which is kind of what we had suspected, was that individuals from these marginalized backgrounds, people of color, were at greater risk of exposure. They lived in multi-generational housing. They were sort of frontline workers, used public transit. They also were more likely to die compared to individuals from white backgrounds. And what it actually highlighted was the social determinants of health. Those things that are sort of present in the lives of individuals from these backgrounds who have challenges with finances, with food insecurity, and with other elements that make it challenging for them to navigate and move forward. These were the most vulnerable individuals, and they were the ones who were most at risk of getting infected and also dying and losing a caregiver. Next slide. And so as a result, there were thousands of kids, 325,000 kids, at least at that point, who, as a result of the loss of a caregiver, actually ended up shifting into poverty. There was also a great number of kids who were teenagers who were wage earners for this low-income group that also lost jobs. And that also contributed to a lot of these children going into poverty. Next slide. So this is sort of wrapping a bit up with, some of the risk factors mental health wise that are offshoots of some of the challenges that individuals from marginalized backgrounds face. And I always want to highlight that there's a new crisis of Black suicide. Individuals who are Black, they have had over the centuries and certainly this century increased risk factors, trauma, certainly financial hardships, disparities in healthcare and many other things. And that certainly contributes to an increased mental health burden. But the risks of suicide have historically been very low. However, in 2018, suicide became the second leading cause of death in Black children 10 to 14 and the third leading cause of death in Blacks 15 to 19-year-old. And for Black kids who were younger than 12, they were more likely to die by suicide than their white peers. I mean, what we've seen over the past 3 decades is that this trend has shifted, that there are more suicides percentage-wise and actually numbers-wise for Black children in this age group compared to their white peers, and that's been a significant shift. And there have been a lot of risk factors that we've needed to look at. Blacks have a lower rate of engagement and completion of treatment for depression. Individuals who've had suicide attempts, they're less likely to have been diagnosed with a mental illness. And even after having a suicide attempt, less likely to get treatment. And there are other factors that are contributors here, particularly increased access to firearms and increased mortality there. Next slide. But overall, even outside of these marginalized groups, our kids have really struggled during the pandemic. If you looked at some of what has been happening with emergency room trends during the pandemic, particularly again earlier on, the emergency room visits dropped dramatically for medical services, right? For non-emergent visits, they dropped from 32% to 27% and overall dropped by more than 50%. But even though medical visits dropped down, visits for suicide ideation, suicide attempts doubled, increased by 100%. And like I mentioned, kids who usually would come to the attention of authorities for having contact or experiences of abuse or neglect, those emergency room visits actually dropped down by 89%. Other studies, the CDC reported that kids in mental health crises actually increased in terms of their emergency room visits, 30% increase for kids aged 12 to 17 and 24% for kids aged 5 to 11. Next slide. And to kind of wrap it all up, this was a larger study that didn't look at direct data. It actually looked at medical records of about 32 million kids in terms of insurance claims. It was from the Fair Health report in March 2021, more recent data. And it actually looked at data that sort of transitioned even further into the pandemic. And what we've seen is that overall overdoses, intentional self-harm claims, substance use disorders, claims for depression, anxiety, they all increased substantially in 2020 compared to 2019. And most of those spikes were early in the pandemic. I mean, thankfully, we're getting some progress with things opening up, but I think we're going to start seeing the results of all of these challenges that were happening during the pandemic. Females, it seems to have more claims than males, right? There was an increase there from 63% to 71%, so proportionally more also, and increased proportion of mental health claims compared to medical claims in the past. We certainly at the Child Study Center, as well as throughout the city, have been using telehealth a lot more, which has allowed for increased access. There are some challenges there, but it certainly has been a tool to allow us to be able to reach kids that really, really need help. And I think that's sort of the story, is that kids are suffering in silence, and some of the traditional ways of kids getting help, particularly being in the schools and getting access to mental health care, they haven't been able to do that. We haven't been able to identify a lot of kids who actually need help, and we've had to think outside of the box on how to be able to get services to kids, but even before that, to identify kids that need help so that we can prevent worse outcomes. So I'll pause here. and sort of turn it back over to Dr. Havens.
Yep. This is really depressing, Aaron.
It is.
Let me say a couple of things about the increased demand for mental health services, which I know I just said it was depressing, but we're really trying to, seize the opportunity in this crisis. At baseline, New York City actually has a fairly good, relatively speaking, mental health system for kids and adolescents. It has a pretty robust system for the kids who are covered by Medicaid. I'm talking about compared to other states and other cities. Lots of clinics. We actually have a fair number of inpatient child psychiatry beds relative to the rest of the country. And we have a pretty robust private practice system for people who are upper middle class and wealthy. Actually, the most challenging situation in terms of accessing mental health tends to be for people who have commercial insurance, because the commercial payers have been so bad about paying for mental health, so access is really an issue. But again, I do a lot of national work, so I'm just speaking comparatively. We know at baseline, 1 in 5 kids over the age of 5 has a mental health disorder with some level of impairment. So same statistics that you find in adults. We know even 1 in 10 young kids under 5 is going to have mental health challenges. We know most mental illness starts at least in adolescence and often in childhood. And we know there's a group of really much more challenged kids that tend to concentrate, for example, in the child welfare system, kids that are removed because of abuse and neglect. And that's a complex, multifactorial thing we can talk about later if we have time. But we've tried hard in New York to respond, in New York City, to respond to and develop an appropriate system. It's always been challenged and always been usually seasonally, because what happens is kids go to school and school's the stressor. So as the school year goes on, kids have more challenges and you see the entire child system starting to saturate. What we saw with COVID was really different, because at the beginning of the pandemic in the spring, which is usually our busiest time on the acute side, by acute I mean inpatient child psychiatry, nobody was coming to the hospital for psych, because obviously the COVID was overwhelming the hospitals. And actually a lot of the beds that were in the system for kids were converted to beds for adult psych patients with COVID. And we didn't really need the beds at that point. And then as things calmed down over the summer, we started to see the demand increase. And then over the fall into the late fall, things have really been escalating. And at this point, what we see is our entire systems are saturated, are across the board, the private system, the public system, the inpatient beds. Health and Hospitals operates about 65% of the acute psychiatry beds for kids in New York City, because most of the private hospitals have gotten out of it because you can't make any money on it. And we, generally speaking, don't have any beds every day. And that's not typical. That happens usually in the late spring, summer for us. So a lot of high acuity kids, definite increase in the severity of suicide attempts. And again, I see that's kind of an end point. That's the sort of the high end, but that's on an overlay of a lot of kids struggling with depression and anxiety across all classes and races. As the point that the COVID report that Aaron was talking about makes is that, the most vulnerable are always hit the hardest. But in this particular case, with the double whammy of loss and income, job loss, that population is at the greatest risk. And Aaron talked about the reports to the State Central Registry, which is the mechanism by which you report a concern about abuse and neglect, have dramatically decreased because kids aren't in school, and that's where a lot of those reports get made. On the flip side, reports about domestic violence have been on the increase. So we're looking at really stressful home environments. Now, again, there is good news. Everyone's going back to school, right?
Yeah. Yes.
That's good news for the kids and the parents. Most kids are really resilient. And I think that the kids that have, again, as I said in the beginning, the amount of support your family can provide you in times of trauma really indicates how well you're going to do. So I'm not worried about long-term generation COVID, et cetera. It is revealing the real fragility of our mental health system for kids, and the opportunity we're looking for here as advocates. And I've spent a lot of my career on advocating about what the mental health service system should look like for kids, is to really try to expand the access to kids and adolescents to mental health services, and in particular to move it earlier in life. So kids early in childhood and in elementary school can get identified and get the services they need, because while we can't necessarily prevent mental illness, we can certainly palliate it, and treatment is the way that you palliate it. So you can have a fairly serious mental health condition but be in good shape because you're treated. But the access to care has been such a challenge. So we're using this as an opportunity to try to really push our city and our state to move some of the resources in our mental health system to an earlier time in life, and to the places that kids and families really are. Like, so in primary care when kids are quite young, in elementary school, in daycare, in pre-K. You know, I was on a call today with OMH about what we need to do to make school-based mental health services more viable and more accessible. Because right now we wait for kids to get sick and then we take care of them, and really we should be getting them quite early and holding on to them. So maybe something positive will come out of, you know, the really difficult experiences we're having right now.
Thank you both so much. I was thrilled that you were going to come and talk about this tonight, because it's been part of our conversations throughout this year, you know, as our kids were home. And, you know, one of the things that came up over this time was, you know, your statistics didn't surprise me at all, as sad as they were. But one of the things that came up for a lot of us, especially those with teenagers, was that there seemed to have been, at our schools in Community Board 1 and in our district, there was, you know, there were extra guidance counselors put on and mental health professionals put on in some schools and some areas. But I'd like to hear your impressions about making it optional. Like, for me, you know, to know a teenager is to know that they're not really wired to be preventative about much. So,
except their homework, right?
I mean, so what you're seeing in the statistics is when the parents finally take them to the ER. You know,
or they, yes, exactly, yeah.
Right? Or there's some event that takes them to the ER, when they're not with the parents. But largely, I would imagine anyway, that parents are involved in that moment. And I'd like to know, you know, hear your impressions of what you found when you went around. I mean, I don't know how much liaising you do with our schools, and if there's a reason that they continue to make these services optional, especially when they have statistics that were rolling in at the beginning of the pandemic, where they could see that a lot of these things weren't being dealt with until they got to the hospital level. So I'd love to hear your impressions on that, and also about the fact that, you know, our insurance companies don't pay our mental health professionals a living wage, and a lot of them, as a result, have to be private. And we're moving further and further away from our goal of making it accessible, unless we face that. And we'd love to hear your experience with that as well.
So these are great questions, and
You can stop sharing the screen so we can
yeah,
talk.
let's look at each other. Jen, are you running this show? I think there's a Jen that's running this show.
I am.
Yeah, great. So I can start talking about this. These are great questions, Tricia, and you know, there's a couple of really entrenched problems in the arena of mental health that are related to stigma and ignorance, I would say. You know, we've learned a lot I've been in the field for about 30 years, and we've learned a lot about the developmental course of mental illness and how things start earlier in life and what kind of challenges start earlier in life, and a lot about what kind of family risk factors, particularly early childhood adversity, how they relate to mental health problems. We've also learned a lot about how to treat even complex problems. We have much better evidence-based treatments, and by evidence-based, I mean they've been, you know, carefully studied and randomized trials and been shown to work. There's a lot of suspicion of psychotherapy. I personally believe it comes from the psychoanalytic world, where people were seen, you know, multiple times per week without much efficacy in the 40s, 50s, and 60s and 70s. And that, sorry, Aaron, I know you're, that was the prevailing treatment model, and it was big in New York, psychoanalysis. And I think people sort of got this suspicion of mental health treatment, like if you gave people access to it, they would just go there and stay and stay and stay, which I don't think is true at all in how people use services. But there also is this, if you think about the way healthcare has evolved, particularly healthcare for children, when you have a baby, you go to like 18 well baby visits in the first 2 years, and they're called well child visits, and they're considered to be preventive. And the point is to keep your baby and your child healthy. And when you go to those visits with your kid every year, the kid's height and weight is on a growth curve, and you're following that, and the pediatrician is using that to make guidance, to make decisions about whether a kid is developing in a healthful way. We have no equivalent for that for mental health. You actually, in order to bill for a mental health visit, the person actually has to have a psychiatric diagnosis. In other words, you have to be sick to get the services. So this is really a deep problem. The insurance companies take advantage of it. I don't know why. I don't know why insurance companies don't just say, let's get our people mental health, because poor mental health affects all health outcomes. But they have gotten away with that, and they are allowed to under-resource mental health services. That's been the basis for parity law. You know, parity law came into being, actually, it's an interesting story, during the financial collapse of 2000, when was that?
2008.
2008. Paul Wellstone and Patrick Kennedy, Teddy's nephew, were working on parity law, federal parity law, for years. And that parity law says you can't discriminate between mental health and health services, and how you allow access to service, pay for service, review services. And they could never get it passed. And they actually slipped it into the federal stimulus bill, the TARP bill. And that's the first time no one was really looking. And that's how we got federal parity. But parity has yet to be effectively enforced, as we're starting to do that in New York State. But there's also a mindset that we have to change, which, you know, we have to understand that mental health is part of health, and there are treatments that work. People will not just go to the trough and drink them forever, which is a fantasy that regulators have it too. And that spending money on this, especially early in life, and for kids, and especially for families that we know are at very high risk because of intergenerational abuse and neglect. The African American community is also affected by the sequelae of intergenerational trauma related to slavery. We know if we intervene with moms with young children who need help to be more attuned to their kids, to deal with their own depression or trauma, we know that has an impact on child outcome. We should be spending this money, but it's a matter of political will. Our mental health system, I'm sorry, I'm ranting here, but our mental health system is really designed to be reactive, to wait until you're sick and then to treat you. Much more emphasis on the adult side of the system. We in the child advocacy world say the adult mental health system has a budget and the child mental health system has an allowance. So we're trying to change that. But does that answer your question, Tricia?
Yes.
And the insurance companies are ridiculous. Why they get away with this, I don't know. But remember, the big ones are for profit.
Correct.
It's been
Is there
capitalized.
is there a curriculum that you share with the guidance counselors in the public schools, for example? I'm just curious in terms of, our guidance counselors, which are spread way too thin, or maybe it's the principals, maybe it's teachers. Is there some sort of curriculum that you share with them? Things that you can do to make a difference in the early grades and along the way, or is this always individually based?
Well, so that's another great question, and the Department of Education and the private schools invest in guidance counselor staff, sometimes social work staff within their schools. They don't do clinical work. They're not trained as they're not functioning as mental health professionals, even the social workers. They do have kind of a wall between the Department of Education staff and what kind of clinical role they can play. Teachers, teacher training, teachers aren't trained about social emotional development. They're not trained about mental health challenges. That's not part of the education of a teacher. So we don't have the access or the resources to deal with the Department of Education staff. That would be expensive. I know they've done a lot of work offering a lot of additional trainings during COVID, trainings to everyone in the schools, the social emotional learning, training in trauma-informed care, that coming from DOE. But the best way to affect a school actually is to put a mental health service in the school, like on site, and to make sure the people in that mental health service have enough time to actually work with the school and do hands-on training and do hands-on identification of kids. If I were in charge, every school would have a mental health service within it. And Tricia, to your optional question, we would screen kids for things like depression, like we screen kids for height and weight. And that would be a normative thing we do. We do that now in the healthcare system. We screen every kid over 12 for depression. And it's not an option. I mean, you can say, I'm not going to answer those questions, but it's not like the Joint Commission, which regulates hospitals, makes us ask everybody those questions. So I think there are things we can do. We can't take on the entire school system, Wendy, without, that should be like an educational imperative that DOE invests in. I don't understand why DOE doesn't spend some of their money on mental health, because it really tracks to the outcomes kids have. Most of the kids that drop out of school have significant mental health problems. So everything they are evaluated by in terms of outcomes is affected by this, but everyone's expecting the healthcare system to take care of it, but there's not enough resources, and really important problem now with the increased demand. I think basically the demand has doubled from 20 to 40%. There's not enough workforce. There are not enough There are not enough of us. They're not enough. There's certainly not enough child psychiatrists. There are 8,000 child psychiatrists in America. There are 80,000 adult psychiatrists. So we're a subspecialty fellowship, so there are less of us. Huge demand now for social work, master's level clinicians. The entire mental health community is freaking out because DOE is going to hire 500 social workers to put in the schools. And we're like, where are we going to get our social workers? Because that's the primary workforce in the mental health clinics.
Yep.
Sorry, just to follow up on Wendy's question. So isn't there a simple, like, cheat, like a sheet telling them, please look out for these certain behaviors or symptoms just to flag it? Because I recently went through an experience and it just shocked me, the process of figuring out finally what was. So my son at school constantly had stomach problems. It was first the teachers thought, oh, he just doesn't want to be in class. Then we went down the rabbit hole of, going through food allergies, then a GI. Then finally, I went to the regular pediatrician and he goes, Sarah, this is manifesting in a lot of kids these days. It's all psychological anxiety. It took us 5 months of hell to finally somebody tell us this would have been a very simple thing if the school had said, oh no, he wasn't going to the bathroom to avoid class. This could be something else, but they had no idea. And no blame to them. They're not equipped that way, but there's simple things like watch out for these 4 or 5 things, so they can flag it early enough.
Yeah, I wish it were that simple, particularly in kids and adolescents, because mental health challenges present a little differently in kids. And I guess you could say, hey, if there are behavioral challenges that are new, or if your kid starts doing poorly in school, or if your kid stops sleeping, or if they start pulling away from the family, right? But if you look on the surface, those things are very non-specific and they could go for anything, which is unfortunately kind of what drove you to the rabbit hole. I mean, and physical symptoms too, right? Headaches, stomach aches, right? Things like that. I think the best way, and some of these educational initiatives really help the guidance counselors, the teachers to do, is to recognize maybe some of these things to bring them to the attention of the parents or whomever. But then, as Dr. Havens mentioned, there's a lot of stigma, right? There's a lot of denial, which isn't the fault of the parents. It's the fault of, this has been the case for, decades and centuries. And I think sort of a growing awareness of mental health issues is certainly something. Giving talks like this, having people who are in administrative positions be educated about this, making it a bit more normative, right?
Yep.
And I guess that gets a bit back to Trisha's point of like making it required. I mean, if we had unlimited resources, unlimited man and woman power, we could certainly do that. But in the absence of that, I think that's the path that we need to move towards, is making it more normative, making people aware of how these symptoms can be different in kids and adolescents, and making them aware of the fact that, well, it's not such a terrible thing if you go and have therapy and have some place to go and talk about the challenges that you have. You're not going to be relegated to having to take a medication. The medication and those are the things that are important.
Doesn't mean you're crazy.
And it doesn't mean you're crazy. It doesn't mean you're crazy. Exactly. Yeah.
I ran a clinic in the 90s for families affected by HIV, which was by definition substance abuse, because that was the vector for heterosexual spread. And, these were very, very challenged families. And they would go to their medical doctor, and their medical doctor would say, well, we have this wonderful mental health service for you and your kids. And they go, what do you mean, doc? I'm not crazy. I'll go to substance abuse treatment, but I'm not going to the mental health provider. So I think it's an awareness thing. I think it's a normalizing thing. Remember what I said, 1 in 5 kids. The most mental health problems are much more common than health problems in kids and adolescents. Right. Much more common. So your kid having a stomach attack, a stomach ache, that's in the differential. You have to make sure it's not a medical thing, but that's a very common presentation of, but remember, the school staff are not allowed to diagnose kids. They're not allowed to talk to that way.
Got it. I mean, it's a challenge, and you're right, because we told our son maybe we should talk to someone, and it shocked me his initial reaction. He goes, "Are you and Daddy getting a divorce?" And I was like, and they're used to it from schools apparently, that the kids that have this, they called it banana split. He goes, "Is this like a banana split?" And I was like, "Oh no, this is for other reasons." And it's been like interesting. Are we getting a divorce? And I'm like, "No." But anyway, it's a lot.
Sarah, that's good. They're doing that. They're talking about divorce in the schools. This concept of social emotional learning, that's penetrating.
Yeah.
Kids don't miss a thing. They know everything. So, and the kids are much cooler than the adults are. Kids talk to each other about depression, and they're all talking about suicide all the time. The studies on community samples of kids, like 18% of kids think about suicide. And that probably tracks to the 18% of kids that have depression. Those things go along, not always, but so how do we make this people have challenges, and the harder your life is, the more difficulties you've had, particularly as a very young kid, the higher the likelihood you're going to have challenges as you grow up. So how can we just say that's the way it is? My friend Rahel Briggs, who started a big early childhood program at Monty, we used to say to mom, they do the adverse childhood experience survey, where you ask people about the 10 kinds of adverse child experiences you can have: abuse, neglect, divorce, loss of a parent, incarceration, substance abuse in a parent, mental health disorders in a parent, a couple other things. And then you say to the mom, well, listen, you've had 5 of these adverse childhood experiences in your life, and look at what a challenge this has been for you. I want to work with you. Your baby only has 1 now. I want to work with you and your baby so your baby doesn't have any more. And that's an approach that's very effective with mothers who don't want to deal with their own trauma, don't want their babies to have trauma. So, but getting those kinds of services to moms and young children is a real challenge. That's what I mean about pushing it down and normalizing and having it be the expectation. And Tricia, I would think, mandatory school screening for depression. There's actually evidence that the suicide prevention interventions that are educational, like where you talk to kids about suicide and why not to do it, are actually not effective. What's effective is screening kids and identifying like the major risk factor for suicide or suicidal ideation, which is depression. Mm-hmm. And as kids go through adolescence, depression increases. Although younger kids can get full on depression depending on how stressed they've been in their lives.
Very interesting. Anyone have any questions?
I hope we didn't depress you too much.
No, this has been a topic of discussion, as I said, during the whole pandemic, as we've all been crammed into spaces that weren't built to be in 24/7
with each other.
Are supposed to be out socializing and interacting and growing. Yeah. And there have been lots of things we've never seen before in our houses. And so it's a really important thing to be talking about and advocating for, frankly. Yep. We did pass a resolution asking for mandatory services. And, I love the word screening, because I think that is probably more useful. So definitely take that with us and maybe incorporate it into our next ask in that department. So along with, affordable healthcare and
mental health care,
they're shut out of being able to get help. I mean, I looked at mental health providers that came with our health plan, and there was a list of like 20, and I called each one, and 19 of them were either out of business or had moved out of state, and it was still the active list that the insurance company was using.
Yep, they get away with that. They get away with
that. We have 20 providers near you within 5 miles of your zip code, and it turns out, 2 were in Jersey City, and unless you're, a bird, you don't get to crow fly yourself to Jersey City from Lower Manhattan very easily. So I think that there were so many, like you said, I think they did a lot of it just to make it look as though they had this vibrant database full of providers.
Yep.
But when you drill it down, there were probably one or two in all 5 boroughs willing to work for the $110.
Exactly. And because
That they're
they don't have to in New York because there's so many wealthy people that can pay more. That's really true in New York City in particular.
Yeah. And it's sad because there's a lot of people who can't, and then they're shut out and the schools aren't offering it, right? So then there's no route out for them.
I think it's a matter of political will. And that's why, unfortunately, I've been in this business for a long time. Disasters usually do good things for us. Like after 9/11, when the firemen had PTSD, post-traumatic stress disorder, that really normalized that you can have a really bad reaction to a really bad stress and still be like a normal person.
Right.
And so, we're always leaping on these kind of terrible things because they allow us to move the needle a little bit on understanding and ability to commit resources. So that's the best we can do.
I can't thank you enough for coming. This has been really informative, and we'll be taking some of these ideas forward with us. I think you're right about it being an opportunity. So sooner rather than later, we should all be advocating for not only normalizing it, but figuring out ways that we can incorporate and support our vulnerable communities who this is largely out of reach for. So thank you both.
And
So,
look, we can sit in the same room without a mask.
Yeah.
I know. Amazing.
Yep.
So
All right, take care. You keep up your good work.
thank you
Thank
so
you.
much.
Thanks for coming.
Take care.
Really appreciate it.
Bye.
Right. Next up is Sarah Jones and Susan Diaz from the Office of Community School at Department of Education to talk about the updates on the Summer Rising program. Welcome. Hello?
Susan Diaz and Diane Orweiler.
Oh, okay.
Your last name. I'm with you both as panelists, so you should be able to speak.
Hi, Diane Orweiler. I'm from DYCD. Nice to be here with you all, and thank you for having us.
Welcome.
Hello. Hello, everyone. This is Susan Diaz from the Department of Education. We're going to be talking about Summer Rising, and I'll see if our colleague Sarah Jonas is on as well. And let me try to get my video on.
There's a call-in number. I'm just going to unmute them, Trisha, to identify if that individual is Sarah Jones.
Okay.
Call-in user 1732. Is that you, Sarah Jones?
Jonas.
I'm sorry, Jonas. Hello? Calling user, can you please identify yourself? No, I don't believe that's it.
I can actually start, and then if she joins, that's great as well.
Okay, great. Thank you. Welcome.
Okay. Thank you. So I'm here just to talk a little bit. Hello, by the way. I'm Susan Diaz with the Department of Education, Office of Community Schools. And we have been tasked with supporting the launch of Summer Rising, as well as on the DOE and supporting the SYEP initiative. And so Diane is also here to answer questions about SYEP as our partner, our partner at DYCD. So I'll just start by telling you a little bit about Summer Rising. and our the initiative that we've recently launched for all children, all students across our city, regardless of whether you are in a DOE school or not. So it's a full day and in-person experience for grades K through 5 days a week, 8 to 6, Monday through Friday. And it's starting July 6th and going through August 20th. And it's going to be staffed by DOE teachers and staff, as well as community-based organization staff. And this is where we partner with the Department of Youth and Community Development for the Summer Rising initiative. And they have been working with community-based organization providers to help support this work and launch. So we also have programming for grades 6 through 8, which is 4 days a week, 8 a.m. to 4 p.m. Monday through Thursday, with the same dates of July 6th through August 12th. For high schools, we are offering course credits, bridge programs, and each individual high school has its own separate program. We are also working with the Department of Youth and Community Development on their SYEP initiative and supporting that work within our schools, as well as the larger community. So just to name for enrollment, if anyone would like to enroll in this program from K to 8, they would go on to the Discover DYCD website, create an account with the city, and all the prompts are there. It's accessible in 72 languages, and enroll in the program. And then once an application is in, then the student the families will get outreach from a community-based organization directly about their application and about enrollment. For our students should have already enrolled, and DYCD is now going through the lottery process for their community-based initiative, as well as for their school-based initiative. Enrollment is happening as we speak for all of that for a July launch. So we are definitely doing all the rigorous health and safety protocols. We're working really closely with the Department of Health on ensuring that we are up to date on all of our information for the summer as well. And our timeline for families to enroll is right now, and being able to have every single school connected to a program is our goal. And we are there in terms of being able to have every school be connected to a community-based organization in order to offer this program to all New York City residents who are students. So that is it for a presentation, and we're happy to answer any questions you have about the Summer Rising program and SYEP.
I have, thank you so much, Susan. I have a couple quick questions and I want to open it up to the committee. Are these all in person?
Yes. For the Summer Rising K to 8, they will all be in-person experiences. And then for SYEP, Diane, if you want to share the nuance there with the in-person versus the virtual.
Thank you, Susan. Yes, so for SYEP this year, for the participants ages 14 to 21, there's options for them. They have an in-person option, hybrid option, or a virtual option. So depending on which provider the participants do select and what the providers have to offer, the participants will be able to choose one of the three.
Okay, wonderful. And are these all academic? Is there some social emotional programming? What are the offerings? Do you have that yet?
Yes. We will be offering a combination of social emotional supports as well as academic. So we are hiring DOE teachers to provide what is you would typically think of as summer school. So academic supports that continue the curriculum that they had that our students had begun this year, as well as having social emotional supports and enrichment activities for all of our young people.
Right. And is there some sort of a qualification to engage in the academic courses? Do they have to have failed, in other words, the course, or do they have an option of bettering their grade? What could these classes, let's say a child had a D in Algebra 1 or a C, and they wanted to see if they could better their grade. Would they qualify to be able to take advantage of the summer school program offered for Algebra 1?
So that I would have to get back to you. For our high schools in particular, if a student has failed a class, they will be able to make it up. And we have a course catalog for families both in the public school and non-public school system to be able to review and find out where that course is offered throughout. So for our students that are potentially going to who will potentially fail this course, they'll be able to do makeup, but I don't know if we're offering students to accelerate. Each individual high school is offering its own programming that's specific and targeted to each population. Mm-hmm. So if there is a question for a specific school, you can reach out directly to the school and find out about what's being offered at that school.
Has everybody here who has everyone received correspondence from their schools on this? I'll be curious to hear from the committee members. Anybody want to chime in?
I have, but with pretty much no explanation of what it was. My wife got the correspondence and was like, I don't know what this is. And because I'm on this committee, I knew kind of what it was. So I was like, the way it was written, it sounded like all of a sudden the Youth Rising was taking over from Bob Townley's after school organization. She was like, I think we have a new after school provider. I'm like, no, it's a whole other program.
Right.
So I got it from one of my schools, one of my kids' schools, and they explained it, and it was clear to me from one of them, not the other.
Yeah, I would say it's not been clear at my son's high school. Everyone should answer, but I have a follow-up question later on, just if we could relate back to what's happening in Community Board 1 specifically, but you can get to that later. Thanks.
This is Rosa. We got notification through our school, but I guess because our school is very small, the opening, I guess, at the other school that you're sort of a feeder school to didn't happen until very recently. And but it seems very ambiguous. I'm really happy that you guys are here to talk about the program, because it basically said there's going to be academics, and there's going to be like social emotional, and there's going to be outdoor playtime like camp. That was about it. There was no further details, enough for somebody to be able to make that judgment of, okay, do I feel comfortable doing this, or what exactly is this, or is this like a fly by the seat of your pants kind of thing, where it's sort of being made up as we go along. And so I heard like one thing for me that was a little, I guess, caused a little bit of hesitation was just the hours. I think that the fact that you have such a long range of hours is great. I think that for, like, say, my child, that would be too much in any given day. But then I heard through someone else through the grapevine that you could actually pick up earlier than at 6 p.m. And so there isn't enough detailed information for people to be able to make up their minds, basically. So if enrollment is down, then that might be why, because nobody has any information and not much is posted on your website.
So we do have a family-facing website on New York City site, and I can definitely send that so you can also direct families to that site, which will outline each step. The critical piece is for families to create the login and then apply to their school's affiliated site. And you can also reach out directly to the community-based organization that is part of the affiliation site. And they have, been doing summer camps for many, many years, and they will be able to give you a good picture directly of what is going to be happening at your individual site. In addition, obviously, to the school team in terms of the academic portion.
And along those lines, what are the schools in Community Board 1 that are participating, and what is the community-based organization that's supporting those schools?
So I would encourage you to log onto the website, and I can actually do that right now. I'll share that every school is somehow affiliated, so there won't be a school that would be left out in your community board, but for a specific list, you can add in the zip code as a search function and be able to populate exactly what schools are offering.
So like one of our zip codes is 10007, and the one's 10013. What are the other zip codes in our neighborhood? I'm just curious. Other people speak up. I know those two.
10038.
10005. Wendy, I know that PS 276 is a school that has programs. PS 89 has elementary services. I think PS 289 has middle school. Weirdly, they're both run by different agencies. I think one.
I was going to say, and then what's the nonprofit there? Or the
so I think it's CPC for PS 276 for elementary and for PS 89. But bizarrely, at 89 and 289, they're 289, I believe. The middle school is Manhattan Youth, and the elementary school is CPC. And I'm trying to remember what else I was looking at. But I feel like pretty much all of them were CPC, at least for elementary when I was looking
And what is
into it.
CPC?
I can ask Susan to answer that question.
Yeah.
It's the Chinese Planning Council. It's a community-based organization that works in your area.
Oh, okay. That's news to me. Okay, thank you.
And we've worked closely with them for many years on summer camp programming. So they're very familiar with summer camp.
So each of our schools, something is going on at each of our schools.
Each of your schools has an affiliated site, so it may not be in that building. We've consolidated to maximize resources.
Gotcha.
But if you log on to the Discover DYCD website, which I will definitely share with you, you would be able to see exactly what schools and where are affiliated in your.
And they register not there, but on the nyc.gov?
Yes.
Okay. All right. Okay. Anyone have any other questions?
There's something very new this year. I mean, obviously they're going to be in person, which was good to hear. But is there anything really different this year versus other years?
The coordination is a big difference from last year. Last year, you either did summer school or you would do summer camp through the DYCD programming. But now all children, all of our students have the opportunity of having a really enriched experience moving forward. And so we have done models. The Office of Community Schools has done this model in the past on a very small scale. But this is going to be a larger scale where every student who wants to participate can participate, which is different from previously.
I have a quick question, Susan. Are all of these classes, I remember someone had reached out to us saying summer school previously was a recorded teacher on a huge screen and 60 or 70 kids sitting in an auditorium logging into, say, that Algebra 1 class. Are all of these academic programs taught by live teachers in the flesh? And if so, what are the class sizes? What's the structure?
So that would be a question for the high school team in particular, because our elementary school programming has very specific Department of Health ratios that they need to meet. So class sizes cannot exceed, I believe it's 25, but for our high schools, it could be different. I would just share that unless you are mandated for summer school, you would not necessarily have the option to do virtual.
Okay.
And I just wanted to share with you guys the platform so that you could see it, since I was able to share my screen now.
Auditing this? I mean, do you have people going around and checking? Because, one of the things that my son, who's now in high school, but when he was in middle school, he actually had the chance to participate in 2 different locations. And one was really enriched, and the other one was literally a bunch of kids on their phones, and there were basketballs in the gym if they wanted to play, with like nothing going on all day long, day after day. How do you touch base with quality issues, provider to provider, or even within the provider, program to program?
We do quality reviews for each of the organizations that we work with. And so if there is a concern, we have a few ways parents can reach the Department of Youth and Community Development directly, and they can send someone out to do an in-person visit right away. So for instance, if you call the Department of Youth and Community Development Youth Connect hotline, which we can also share, or even 311, we would be able to gather information from you and then have someone go out and see the programming and verify. And then we have a quality review process that the Department of Youth and Community Development goes through every year for every single one of their contracts.
Susan, if you can share that information over to me and I can paste it on the chat, that'd be great.
Thank you.
That would be helpful. Thank you, Jen. Anyone else have any questions about this?
Read about funding at all for this year, or did the funding really come through?
That question, I don't know. I'm not sure what the specifics are about funding. I do know that I think this year is sort of an anomaly because of the budget, the funding that's coming in from the federal government for summer. But I would say that in the future, it could be an issue, and it might possibly be an issue now. It would be other folks that would be able to answer that question for you. Sorry about that.
This is Rose again. So do I understand it correctly that basically this program existed all along and it's just been hyped up with the federal funding this year and sort of make up for the potential learning loss due to coronavirus and remote learning and all of that stuff? Or is this actually like a completely new endeavor? Because I didn't know anything about this prior to this year. And I'm just wondering if I was just totally ignorant or if this is totally new.
Well, components of the programming are not new, but this actual Summer Rising initiative is a completely different way to do summer school for us.
So the community-based partners that you're working with at these locations have had programs running at these locations for years. So it's not like they're just creating something from scratch. They actually are experienced in doing this work at these locations and building upon an existing program, essentially.
Yes, many of them have been running programming in those particular sites. Others, we are trying to expand programming at other schools. So it's a combination.
Okay, thank you.
And are you helping with, any of these organizations? Are they having trouble hiring people, or are they going to meet their employment numbers? I know that's an issue for some summer camps, for example.
Yeah, I'm not really sure. That would be someone else who could answer it for you, and I will take down that question and see if we could get back to you.
That would be great.
Rosa, this is Wendy. I think you haven't experienced it yet because the middle school programs are city funded, and so the middle school programs a lot of our kids have been doing, and that is something that's parents in the neighborhood know about. It's different for elementary, so this is kind of new for us. Thank you.
Thank you.
All right. Any other questions? Fantastic. Thank you all so much. Diane, Susan, thank you so much for joining us. That was super helpful. And if Jen, if you can take the contact or the information they gave us in terms of the website, I'm going to put together a blast to send out to families.
Sure. Susan, since you have my email address, the staff one at CD, you can follow up offline. That'd be great. Thank you.
Yes, I will do that. I have your email and I will gather the information requested and then send that off to you.
Awesome. Thank you.
Yeah, it's wonderful the city's doing this. Thank you.
Thanks
you
very much for coming. Appreciate
So
it.
much.
Take care.
Thank you. Have a great night.
You too.
You too.
And then our last couple of items, the timing is really unfortunate because I'm just about to find out a lot in these coming days. I even thought about postponing the meeting, a good day to go to. So if I get great information and if I feel as though it is worthy of a resolution, then I have talked to Tammy about putting one out and circulating it and calling a meeting before the full board. Can I just take a quick poll by a show of hands? And if you have your camera on, you can just stick your hand up. If you don't, you could put your hand up in the chat or the participant place where you put your hand up to let me know whether you would be available at like 5:30 on right before the full board meeting. 1, 2. Darren, Judith. We have 1, 2, 3, 4. We've only got 4 of us available at that time. I know it's tricky.
You have me, Trisha, Wendy.
Yeah, I've got Wendy, Sarah, Judith, and Darren and myself. So we still don't have enough that I'd feel comfortable passing a resolution. Oh, and Andrew. Okay, so we've got 6. So So maybe, and we're missing a couple people tonight, so that's pretty good. All right, I'm going to consider this. And so just know that I'm going to be getting information on, well, you all probably saw the letter that I co-wrote with Community Board 2. Did everybody see that? Yes, no?
Yes, good letter.
Okay, good. So we're waiting to hear back from the city on that letter with what, they're going to do about the situation. I got an email today that they had opened the wait list, so they listened to one of our points, which is good. One of the things that was worrisome is that they were going to wait longer to hear back from people, especially those that got a specialized and a choice offer. And so we're hoping that they move to resolve that sooner rather than later. It's also incredibly unfortunate that some people got a specialized offer and then no choice offer, but some did. We had a really interesting, if not disturbing, selection of responses when we went to our middle schools to find out what happened there. But the upshot is that from 47 to 50%, we had people getting their first to sixth choice, which is very low compared to what we're used to, obviously. And then we had another big chunk that got 6 to 12. But then we had the most shocking that was nothing at all, or a school that most parents had never heard of. And that was the part where we really felt that, given the fact that they decided to do this because of the pandemic, that if they were going to change the model, an ounce of planning would have been useful. So, also the fact that people are not familiar with the schools that are unscreened, that are with, they did it by geography in most cases, but they could have stood to spend more time on that and fortify the schools before doing this to make parents really more on board for the new model. And they're not on board at all. And they're actually extremely concerned, especially those who got nothing or the assigned school. So what we found out since then is that they responded that they are considering the question about appropriate placements. Because a lot of these schools that the kids were sent to are CTE schools, they're trade schools, they're specific in terms of what the curriculum is. And, it was so random that it really had nothing to do with the child, and it had nothing to do with choice. And so we are hoping to hear back from them as to what the process is going to be and what they're going to guarantee to those families that got nothing or that got assigned. And we're hoping that that is imminent because people are making plans. And we're hoping that by opening the wait list today, it means that they have asked the families with multiple offers to resolve them and also accept the offers and show intention to come in the fall for those who did get a public school offer. It's going to be really important that families that are not coming back release their acceptances, because they obviously don't have enough seats if there are matches that aren't even, there's no match at all. So they're going to have to resolve this, obviously, and we're going to continue putting a lot of pressure on them. I was told by our district superintendent's office that they care very deeply about what Community Board 1 and 2 think in terms of their decisions. So that's why we wanted to partner with them, because together we are more powerful. So I'll let you know what we find out. But I thought if anybody had any questions that I could answer, you could ask them now.
Actually, I just have a quick question. Is it, there's a perception, and I wanted just to see if there's any truth to it, that it was predominantly downtown families and schools that were hit, downtown families that were hit the hardest, or District 2? Is that any truth to that, or just a false perception?
So far as we've found, I don't have statistics on Community Board 3, But from what I have heard thus far, it is pretty much across the board. But there definitely was the intention. One of their goals was diversification. So I can't be sure what's happening in neighborhoods that were prevented from coming to District 2 previously. So that's a really important thing to say in terms of high school. I did find out that, I mean, here's an example. LMC sent 28 kids to Millennium last year and the year before. This year they sent 2. So this is the thing that's shifted dramatically. LMC had one of the largest percentage of kids with no offer and assigned to 5 or 6 different unscreened schools nearby. Although the West Village did too. Their CB2, you know, their middle school, Morton Street, had a pretty, for considering the size, they had a large amount of kids have no offer at all. So, you know, it's hard to say, Sarah. You want to think that they did something equitably, but you know, from where I stand, if you're going to make this dramatic of a change and hope that families embrace schools they did not even choose 1 to 12, that you might want to spend some time fortifying them, advertising them, holding tours, open houses, things that you do when you are looking at, I mean, this is what you do when you go to high school, right? You go to the high school fair, you talk to your friends, where are they going? You look at the curriculum, you look at the acceptance rates, you look at the college readiness, you try to find a match for your child because we have a choice system. So if you decide to go to a lottery system when you have a choice setup, that's obviously not a great setup to begin with. So when you want to try to combine those two things, you really have to take the time to do the outreach to the parents and bring them up to speed on these other schools. And frankly, you know, they need to even the playing field in terms of resources, because as long as parents are providing infrastructure, which we've talked about here ad nauseum, you're never going to have equality, right? If we're raising money that enables us to have resources that other schools don't, then it's going to be very difficult because everybody's going to want to come to those same 20 schools with the resources. So, you know, if you hear Teens Take Charge, which is this group, I'm going to pop over to the CEC meeting after this meeting. When you hear them speak, there's 2 things happening. There's the fact that there isn't enough racial diversity, but there's also, and arguably, a larger focus for our underserved communities in resources. You know, they kept saying over and over again, the schools with the resources are in Manhattan, the high schools. Why is that? Why are we kept away from those schools? Why don't we have the right to go to those schools? And so it's multifaceted. We need to be creating resources first, in my opinion, and then we talk about, you know, and level the playing field in terms of that piece. And then we can create great schools everywhere and stop with this facade that our schools are better in some way. We just have more resources. And I think, you know, whenever you have more money, you can do more things. And every school and every borough should have that opportunity. So really all they're doing right now is opening up the city to all scramble for the same schools with resources. Failed approach, period. So I think that their intentions are in a great place, but the procedure, not so much. And I think we have a lot of work to do. And certainly over time, we've certainly got a lot of money too right now. And we have this opportunity to really make some changes across the city in terms of these resources. But, you know, I'm worried about this regime because they received 22 million in March of 20, as you might have seen in the resolution, just specifically earmarked for ventilation and window repairs in our schools, so that come fall, we had proper ventilation in our schools to all go back. They have done next to none of it, like next to none of it. And that was my concern about this coming fall, is that we're not going back to school if we have 30% of our schools that have no ventilation and windows that don't open. And this is a real concern. It's not something that is far-fetched. And we have to continue to put a lot of pressure on the Department of Education and the School Construction Authority and the mayor's office, frankly. It really comes from the mayor's office the more I talk to our principals. So, and unfortunately, you know, we have the same mayor who's been making decisions up to now in office as we start this school year. So we really do have to be really vigilant. So that's my high school update. And then in terms of Trinity Place, oh my God. So Rosa, thank God, Rosa sent me the presentation that the SCA made to PS 150. And it was a PowerPoint of a document they made in what they said was 2019. In 2016, October, we went through a huge thing with them about the gymatorium in that school. We fought, we took it to the task force, we got every elected official behind us. Bob Townley and I gathered data from all of the gyms and auditoriums, not only in our community board, but in community board 2 and 3. And we analyzed the data for the usage in our gyms and auditoriums. And what we found was the gyms were being used 7 days a week to the point where there was hygiene concerns. And then we had the auditoriums at 65%. So we pitched Carmen Farinia at that time, saying the loss of programming would be substantial at Trinity Place. We had seen the problems at Peck Slip. They had to close the street because they don't have enough space because of the gymatorium to have gym, a performance. And then if it rains, everybody comes inside to no recess. It was a disaster. We finally closed the street over there after much anguish. And so we presented, and they agreed to step down and make a gym and an auditorium at that school. It was probably one of the best advertised things ever. It's in 3 magazines and newspapers. We have the minutes from the task force. We have minutes from CB1. I don't know what to say, but they sent the PowerPoint out with the gymatorium in it. So I called Mike Mirasola. We wrote a long letter. He wrote back saying, you know, you should be happy we have a stage in the full-size gym. And there is still space. The space that was earmarked for the auditorium is indeed still in the plan. This is important to say. So we are wondering why they then built a stage upstairs, because they can seat 140 in this multi-purpose rooms that they combined. They are not opening a pre-K. They kept that part of the bargain. No pre-K, 2 multi-purpose rooms combined to 1, seats 140. And I noticed that in the plan, there's a platform there, and there's also a door to a backstage area. So that actually looks like an auditorium in the space they said was going to be the auditorium. We have to figure out why they built a gymatorium upstairs. And my concern is that it's because when they went to build this gym, they realized they might not be able to do a regulation gym in this space. And if the space was long and too thin, they might have hoped that by building the stage and marketing as this multi-purpose, wonderful gymatorium room again, that we could have other events in there. So I sent Michael Mirasola the dimensions of a full-size gym and asked him to confirm the size of the gym. I have not received an email back. Tammy is on that, as is Lucian and Community Board 2. So we're going to wait and see what he comes back with in terms of how big that room is. I will say the plans max the space so that if the width does not end up being the 50 feet that it's supposed to be, then it never had the space to begin with, and they just weren't forthcoming with that at that time. It's not like they can make this any wider, in other words. It is wall to wall. There is definitely room on the length. So we are going to look into that. Like if they were to take the stage out, they could definitely get another 15 feet in length. So I will be getting back to you all as to what the upshot is of that. But there's rumors going around about this. I wanted to make sure and clarify the facts. Those are the facts. And give you guys a chance to ask some questions if you have any.
Thanks, Tricia. I think this is when we throw hissy fits in meetings and we get told how we're being ridiculous, we have to somehow make sure that this is part of the folklore going forward when we're all long gone, you know, because these things take so long and the collective memory is what they count on. You know, it just happens a few of us just keep sticking around.
Well,
we remember.
I sent him the correspondence. I mean, he's got it. It's got to be really for them to say it's been a gymatorium all along and then have to face the email I got from Carmen Farina herself confirming that there was no gymatorium has to be humiliating for the SCA.
I don't think it's humiliating. I think it's just annoying. That's what I think it is. I think it's annoying. It's not humiliating. And I think the other piece of it is that this is why we spent hours and hours and hours. I mean, I'm actually offended how much time I spent on all of those things. And then it just doesn't matter, you know, and that's the way I feel about a lot of this stuff with the DOE. It just doesn't matter. And they honestly, I asked years ago, I asked Scott Stringer to do, when he was, you know, just taking the job as comptroller, to do an audit of the DOE, because I feel like they're not on the up and up, the School Construction Authority. And I feel like this is a classic example that they're not on the up and up, you know, and there's, you know, we'll get to it later on, but of course also the lineup. How many hours did we spend really worrying about how are we going to get in and out of this building because there's no ground floor gathering space. And oh, by the way, I'm sure the ground floor store that they're going to try and lease out is going to be part of the millions and millions of empty storefronts all over, you know, this city. There's going to be an empty storefront that could be a first floor gathering space, you know, just on the other side, probably for years to come, because it's a terrible location. Nobody's going to rent out that commercial space. And what's happening with the lineup and how are people going to get in and out of this building? And this is a problematic space. I mean, we discussed how busy that road is with all the buses and how people are going to cross the street. You know, I just don't feel like any of those things mattered.
Well, they did. I mean, the DOT fairly, you know, we lost this item to the Transportation Committee, as you remember. So now we get two meetings to get our information. They said that the South Plaza is their recommendation. They are, you know, and I think they came to that conclusion because they have to push out that sidewalk because of mechanicals for the building. So they went ahead and proposed that they close the westbound lane of Edgar Street. That is the recommendation. And they will then connect that with the courtyard. If they do, that provides an adequate amount of space. It's an extra 1,500 square feet, at least, probably more.
But how do we know when that's going to happen or not?
Well, I mean, by writing an email every 6 weeks.
Right.
So, which is what we've had to start doing. And the bus is not going to be on Trinity Place. That I also heard. It's going to be on Greenwich. So that is a good thing. And it will connect with that plaza. Okay. So that they'll be left off right on the plaza. No crossing the street. There's no way that there's ever going to be a bus crossing on Trinity Place. I mean, if they do that, then then I've lost all hope. But right now they're talking about the bus stop being on Greenwich. And frankly, they haven't changed the plan. So what they might have done is just called it a gym and hoped that we didn't notice it wasn't regulation size. I don't know how they could think we wouldn't get it because we're so focused on a full-size gym. We only have 3 of them in 9 schools. So we need a full-size gym there, and we might not have the width. The reality is that building might not be wide enough.
And I don't think we have been told still how people are getting in and out of that building. Like, are the children able to take the elevators, or, I mean,
There's 3 elevators. You walk in from the courtyard in front of the Dickey building. The entrance is going to be doors facing south. The doors are going to open. You're going to walk into an elevator bank with 3 sets of 3 elevators.
Okay, so they're going to be able to use those.
Yes, but it's not a lot of indoor space. And when I asked Michael if they had plans to put a covering on the courtyard, at least part of it, he said no. So you'll be standing out in the pouring rain, waiting for people to go up the elevators because there isn't room for all the children to be in that elevator bank lobby. So, you know, that would have been a slam dunk to put a covering over that. You know, what Tammy and I came to is that I'm not used to having to be in design meetings from the moment they approve something. But today I sat in on a harbor school meeting because they haven't moved into the design phase. And I'm so concerned because of what happened at the gymatorium that I'm insisting on pre-design meetings at the harbor school over this pool. And you know, it's going to be necessary because they are not really looking out. They don't see the demand for a full-size gym as a thing. I think
unfortunately, I think right now they're going to take advantage of this pandemic and say, well, you're under enrolled in Lower Manhattan.
I don't think they haven't gone there. You know, I think what they're more likely to do is we have to watch that they don't put those, you know, another school in there, like a D75 or something else would be more likely if they do think the school will be under enrolled. But from what we understand, it's still a choice school. PS 150 is really defining the school. And
is it a choice school like 150 that the first preference is you live in Community Board 1 and then it goes from there?
So this is a big point of discussion right now because they're getting rid of that model. So it's like a blessing and a curse to be a choice school. But seeing that it's elementary, I'm thinking that it's probably going to be choice among the large zone that is CB1. You know, they probably are not going to zone it for Tribeca first or FIDI first.
No, it wasn't before though. I mean, it was CB1.
No, but you know, it enrolled almost everybody within close walking distance. So I'll be curious to see if parents, you know, from the northeast corner of Tribeca choose 150. It's going to be really interesting to see what they do.
Well, and to be fair, when I joined 150 way back when, it really wasn't a neighborhood school. It was a citywide school.
It was, and then we became overcrowded, and then it became a neighborhood school.
Correct.
And then they also prioritized it to the neighborhood. So maybe it'll go back to the previous model, Wendy.
Which was, it was one of the reasons I selected it. It was more diverse, and that in that time in life, that was a positive.
It might surprise people on this call to hear that even PS 234 at one time had 25% variances.
Correct, right.
You know, which is why the bus stop here is really important because there will be a lot of kids coming by bus.
Right.
A lot more.
Thank you for the updates.
Can I just speak to the whole choice issue because I think I'm just learning about it now. But Wendy, to your question regarding the priority, so Kelly McGuire, the superintendent, basically said that he would like input from the parents of PS 150 via the SLT on what we want going forward, which doesn't necessarily mean we'll get what we want, but at least we get to voice it and, you know, put our stake in the ground. And we're just wrapping our heads around it now because I think we do want more diversity. We do appreciate the families that come from further away. Frankly, they're very invested in the school. The fact that they make the effort to come all the way there means that they are very invested. And you know, then there was a question of, well, how diverse do we want to be? How choice do we want to be? Do we want to retain the priority for the existing schools that have priority now, which are like 234, 276, Peck, Spruce? Do we want to just open it all up to District 2? Do we want to just open it all up, period? And then that is also now getting mixed up with the whole question of, I had no idea that all this stuff was going on with middle school and high school and the testing and the assignments and all of that stuff. And so we're sort of navigating all of that. So yeah, any advice you can give us, because you obviously know much more about it, and having older children, you've gone through it all, before. So any advice that you could give us in the pros and cons of each of these considerations while we're trying to figure out what we want would be extremely helpful, and we would much appreciate it.
I think that, really, you're always going to, and at the elementary level, from my experience, you're always going to really attract families that are nearby, because the chances are they have other children that are not that far apart in age. And it's hard. It's hard to get a young child further away to school than that, and that's why elementary schools are by and large zoned. So what I'm saying to you is I don't know that it will make that much difference in terms of the preference piece, unless resources are starved in other places. I think that is really always, it's going to come back to that with everything, I think. And so, we certainly would have the ability, because of the precedences, to have a preference for CB1, not a specific neighborhood in CB1, but CB1 in general, because it's elementary, I think. And then you could open it up from there. And you could also, Rosa, save a percentage, just declare the percentage as 20% or whatever you would like to, because they're also doing that at the middle school level, where they're saying we're reserving 20% for kids on free lunch, and it's only 17% and 7% respectively at our middle schools, but at least they're starting to build that up a little bit and fortify that diversity through those initiatives if it doesn't, happen naturally. So I don't know if that helped or confused you more, but, there's lots of choices about what to, say to them in terms of that model. But I do think that it will continue to attract people in the neighborhood.
For schools that do have integrated, like basically elementary and middle school continuously in one school, do the kids from the elementary grades have to actually test and apply to go into the middle school in that same school, or do they just continue on through until they're done?
They have first right of refusal. So it's like 276. They can matriculate from 5th to 6th grade. And that's always been the way with the DOE models for K to 8. I just don't know if this school is set up for K to 8 in terms of the classroom sizes, because that bigger kids have bigger rooms. So I don't know if that's a done deal in terms of design. That would be my biggest question, because I did remember you saying you were considering advocating for K to 8, which is not a bad idea. We would have to have a design meeting to really see what we're looking at. And the gym matters, because
Yes.
one of the things Mike Marasola said, he goes, we have an elementary, this is the first time he said it, an elementary sized gym. And I was like, okay. Because if you define it elementary, it means that you don't have to have a regulation gym or commit to a specific size. Even though some of our elementary schools do have a gym you can play sports in, they're not required to. And not only that, there isn't even a specific definition of the size of an elementary gym. So that's problematic if you then have a K to 8, because all of our K to 8 schools have full-size gyms because they need them for their sports programs. And we're already short, so it's not like they could go somewhere else and use somebody else's gym, the 6th through 8th graders. LMC doesn't have one. They have a hell of a time. They use, a bunch of different high schools' gyms for their basketball program. And I don't know, and it would be a great question for Bob, if you did have a K to 8, what would that look like for that sports program if this is not a regulation gym? Because you wouldn't want to be sending them away to, you know, the Lower East Side or, you know, neighborhoods away to be able to have those after school programs. Unless you weigh that out as something that parents don't think is important. You know, that's again another community decision, but it's something to consider for sure.
Yeah, they're not too far from the Trinity Church gym.
The what?
The new Trinity Church.
So you are so right, Wendy. We just don't know that the program, you know, what the program at Trinity is going to be for that gym. I do have a call into them actually, because I was just there last night and saw that it's up and ready to go. So I will bring that back to the next meeting, the update on that. Because that's certainly a possibility if they don't have programming in there during the day, that they could then use that gym.
Oh, wow, that's an amazing option.
Yeah,
If the school is physically unable to accommodate that. I mean, I would tell you right now that because of all of the sort of anguish regarding the high school admissions process that's happened, and I don't know if it's the same for middle school, but the freak out is, you know, trickling downwards. And the idea that there would be some sense of stability of being able to continue through the middle school within, you know, a school, a culture, a community, and a curriculum that we all believe in.
Right.
That provides an enormous sense of comfort. And frankly, it's an enormous encouragement for families, even if they're going to have to move, you know, travel further south from the current location to get to, they're willing to do it if they know that they're going to be in the school for 10 years and possibly even longer because they have multiple children. That's a worthwhile investment to them. Whereas if without a middle school, I think there would probably be more loss of the families that we currently have in the school. Because you know, they're like, do I want to make that trek for another 1 to 2 years? That kind of thinking. So I think it's actually critical to the continuation of the school.
We don't have a choice K-8 down here, and there's an argument for that, you know?
Yeah.
So we should do I think I will ask when he gets back to me about the gymatorium size, I will ask him for the, you know, if the classrooms could accommodate K-8.
Okay, thank you.
What's that?
Spruce is just two classes on a grade. Is that right? In middle school, is that right?
Yes.
So the one thing, you know, I just don't know enough about that middle school, how, you know, they often have had too small of a population to have a full battery of some sports and clubs and things like that. So I just think the 150 parents should also think about that, make sure they're ready for a small school, middle school. It's a different experience. I mean, it's one thing when your kids are in middle school, but or in elementary school. I personally think it was really good for all of my kids to go from a 1 class per grade school to bigger, much bigger, in some cases, middle school. It was good to mix it up. I don't, you know, but obviously I understand too, everything's different. It's not the way it used to be.
No, but Wendy, that's a great point. That's worth thinking through. Because I think you would end up at 2 classes on a grade, maybe 3.
No, that we were saying 2, given the number of classrooms.
Yeah. I just think some people should go over to Spruce then and ask the middle school parents, what are the ones of going to a 2 class per grade middle school? You know, it might be fine. People might be perfectly fine with it. But I do know they were having trouble, you know, just filling certain teams. They couldn't offer everything.
Right. Oh yeah, and that never occurred to me. Thank you.
Yeah.
And you know, I just want to thank both of you guys for being in this for the long haul and for being so invested in the success of the school, which, you know, our community is going to, you know, get to benefit from, and for like caring so much about the details and following through. Your dedication is just like awesome. And I just want to thank you from the bottom of my heart.
Oh,
Well,
you're
the
welcome.
last person that wants to see 150 go down is me. I want it to live forever, and I'm sad that it's changed, but you know that's inevitable. It changes every year, but it's really going to change. So it's wonderful that the parents are still hanging in there. Listen, there's going to be a new principal too, which I just heard. So
Yes.
you know that's a big change as well.
Judith, did you want to say something? I see your hand up. Judith? Maybe not. Okay. Anyone else?
Oh, I'm here. Sorry, it was up from before. I think everyone else addressed my questions.
Okay. All right, great, everybody. Well, if there's no other comments or questions, that's all we have for tonight.
So, hey, Tricia, are you talking directly with Kelly, or if there's a meeting that you have with Kelly at some point, can I hop on the call and just listen in?
Yeah, I mean, I don't know that it'll end up being a meeting format. It probably will just be email with him. I think that the meeting format would be more likely to be with the SCA. So I'll let you know. Those tend to just be with Tammy. So it just depends on, you know.
And if it doesn't work out, that's fine. I promise not to talk, but I would listen in and then text you my concerns.
All right, good. Well, I'm going to Governor's Island tomorrow because there's a walkabout and a press event about the pool. And everyone's going to be there. The new chancellor's going to be there. Margaret's going to be there. Everybody's going to say thank you and take lots of pictures. And we found out that the courtyard's only 40 feet wide. So here we go again, right? Like, oh my God. So I got to march over there and really advocate for making sure that we maximize these resources they're about to spend so much money on. And
even Manhattan Youth Gym, which was marketed to the neighborhood as a Olympic length swimming pool, it was 25 yards long, but it was only 4 lanes wide. So, you know, you have to be very careful what they're saying, because when I finally got in there and I said, what do you mean it's only 4 lanes wide? You know, not 6 lanes like a normal pool. So those things matter.
Yeah, it matters a lot. And so we're going to go take a look and say thank you. And oh, what about that?
Okay.
So yeah, so you know, I think it's all about getting in early with these things. So Rosa, thank you for passing that on to me. That was a really important moment because they have not committed to some of these things yet that you might be able to change if you do want that K-8.
And Rosa, are you on the PTA and the SLT?
No, I'm only on the SLT. There's only so much I can manage.
Which is perfectly fine. But I just wondered if both the SLT and the PTA, you know, it sounds like you're doing everything you can over there to meet. If they have a community meeting, because sometimes, like when we were doing the Save PS1 stuff way back when, we would have community meetings and invite outside people in. You know, that's not a terrible idea if you do that. I mean, I not that you want more meetings, but I'd be happy to show up. We have the next
one scheduled for June 22nd, and I'm going to ask Kelly if it's all right to invite you guys.
Oh, that's election.
I would love to listen in on that, Rosa.
That second is election primary day, right?
Yes.
Yeah.
Primaries all day from 5 a.m. to 10 p.m. I'm working the polls again. So I would love to.
Definitely, please do send that to us. I'll just sit in the background, but it'd be great to hear.
Okay, definitely. And I will give you guys email updates as I've been doing.
All right. Thanks very much. And thank you, everyone.
Yeah, and everybody vote on primary day. I'll be there.
Good night.
Thank you.
Good night.
Bye. Good night.
Thank you.
Night.